Hi, I am Dr. Vaughn, one of the elite ICE 50 avatars, to present course on National Center for Drug Abuse Statistics. Course 7 of 9. Drug abuse by sex or gender. Most data resources use the terms sex and gender interchangeably. Unfortunately, few statistics are yet available that explore trends among gender identities. Drug abuse and misuse of prescription drugs is generally more prevalent in males than in females. 22% of males have used drugs in the past year. 17% of females have used drugs in the past year. 4% of males abuse opioids, 3.5% of females abuse opioids. 0.5% of men use heroin, 0.2% of women use heroin. 3.9% of males and 3.4% of females misuse prescription painkillers. Cocaine use was 2.6% of males and 1.5% of females use cocaine. Women and drug abuse. Only 20% of individuals in drug treatment are women. Women are more likely to do drugs with an intimate partner, whereas men more likely to do drugs with other male friends. 32.1 million women in the U.S. have a mental or substance abuse disorder. 39% struggle with illegal drugs. 5% struggle with both illegal drugs and alcohol. The number of women using marijuana increased 12.5% from 2017 to 2018. 9 million women had a prescription opioid abuse problem compared to 292,000 who were using heroin. 4 million misused hydrocodone. 4 million misused oxycodone. 125,000 misused fentanyl. Drug abuse among states. Nearly 70% of law enforcement agencies in the western and midwestern areas of the United States view methamphetamine and fentanyl as the greatest threats to their populations. West Virginia has the nation's highest rate of overdose deaths at 51.5 deaths per 100,000 people. Delaware, with 43.8 deaths per 100,000 people. Maryland, with 37.2 deaths per 100,000 people. Pennsylvania, with 36.1 deaths per 100,000 people. Ohio, with 35.9 deaths per 100,000 people. The consequences of drug abuse. In 2017, the cost of drug abuse in the U.S. was nearly $272 billion, taking into account crime, healthcare needs, lost work productivity, and other impacts on society. $193 billion was incurred in overall costs for illegal drugs, in addition to $78.5 billion for prescription opioids. $11 billion was incurred in healthcare costs related to the use of illegal drugs, and $26 billion for prescription opioids. 326,000 hospitalizations occurred for non-fatal drug poisonings or overdoses occurred in 2016, including unintentional, undetermined intent, and intentional self-harm. 577,794 emergency room visits occurred for non-fatal drug poisonings or overdoses in 2016, with the most patients experiencing opioid poisoning.